Well, it's interesting to look at the evolution of healthcare, and it will continue to evolve. There was different terminology along the way, alternative, complementary alternative medicine. There's holistic approaches, integrative approaches. There's a lot of terminology in this whole process. But in the 80s, it's noteworthy to look at a book that Dr. Bernie Siegel wrote called Love, Medicine, and Miracles. And Dr. Siegel, who's still having a significant national impact, he worked with cancer patients, and he had an exceptional cancer group. And he broke down that group into three categories. And I'll talk about the two extreme categories. The first category were the patients that took their medications on time and died on time. And the third category was the patients that were very engaged and very involved in their healthcare process. And those particular patients actually did better, had better survival statistics and better quality of life measures. So I think what's happening is that people are desiring to be more engaged in their healthcare process. They're more questioning of their process. I think that there is a definite respect with the system of medicine. At the same time, I think that people are more engaged and more inquiring about their journey and more involved in their journey. So in a way, that's a force, that's a market force that is affecting the system in certain ways. So I think it's a very exciting time. One can say that, that there's a crisis of medicine, and certainly there is. But if you look on that coin of crises, on the other side of it is opportunity and new possibilities for expression within the healthcare system. And I believe over time there will be adaptations in that respect. Well, I think that population sector is an incredibly important sector, important part of the population. And that is that there are people that, in general, are not profoundly ill, but they're looking for optimal health. They're looking for optimal wellness. They want to be more engaged in the process. And they want more tools so that they can take more responsibility for their day-to-day life choices. So an approach that would be in resonance with that would be an approach that guides patients about appropriate nutritional approaches to, let's say, certain areas of the life cycle, or that more specifically tie to a certain health condition. An approach that would integrate effective stress management techniques and the mind-body connection. In other words, how the thoughts affect one's reality and how to work on that area, which is something that we can talk more about. An approach that impacts and looks at the importance of exercise. For example, a small amount of daily exercise can significantly decrease the risk of cardiovascular disease. It's the number one killer that exists in this culture. Also, an intelligent application of the healing arts. There's a broad range of healing arts that can be utilized to mobilize the healing process. And in addition, this approach would be one in which it has an appropriate use of supplements and botanicals and natural approaches as well. So in other words, it's an all-encompassing approach that people can be more engaged in the process. And the question is, what are ways to get that information to them in reliable ways, and what are effective means of empowering them to take more responsibility for their healthcare process? And the key is not to deny the benefits of modern medical science, or when they would need to have a colonoscopy, for example. There's important health maintenance parameters that have been well established in the literature that shouldn't be denied as well. Well, I would say that what's happening is in certain training circles, physicians are being trained, and I'm referring to physicians, but nurses have been doing this for quite some time as well, and that is to inquire on these other levels. In other words, what is the experience of that person on this journey? What does this health challenge mean to them? William Osler, the founder of modern medical science, basically said what's as important to know what kind of diagnosis an individual has is what kind of person has that diagnosis. So there is a history of that. I think we've gotten away from it to some degree, but we're coming back to it. So there is an inquiry of that's possible on the level of the more subtle or spiritual process that's happening. If someone has a life-threatening challenge, certainly that's going to bring up certain core life or even existential questions. And getting people connected to those resources is very important, and I think that providers are becoming more sensitive to that. But we have to remember that, healing, ultimately, for it to occur, it has to connect. It has to connect to the internal intelligence that exists within all of us. So, for example, if you give an herb, that herb may in fact stimulate an arm of the immune system. Or if a surgeon opposes surgical tissues, it's the body's natural intelligence and that natural tissue repair mechanisms that actually does the healing and bring those tissues together. If you look at a pharmaceutical, what I often refer to as vitamin P, Prozac, that's given quite frequently. And by the way, I have prescribed antidepressants. I just want to be clear that ultimately you're not giving serotonin. You're giving a medication that affects the breakdown of serotonin that is produced naturally within the body, produced endogenously in the body. So the healing process actually occurs within naturally. The question is, what can we do to remove the barriers of healing, to stimulate the body's natural healing response? And these are important questions to explore, but I think that what's happening is that this inquiry and approach is becoming more possible in today's healthcare, but there are certain challenges, as I articulated before, as it relates to the time that's available. Absolutely, and I have to give a lot of respect to an individual such as Larry Dossey, who basically has explored the power of prayer in the practice of medicine, and also exploring non-local healing variables. So I think there's a lot of interest in working and connecting to patients on the more subtle dimensions to what this experience is about. Yeah, I think there is. I mean, when you look at the Vedic tradition, for example, there's some fundamental questions, and they would even mention that there's a science of spirituality. In other words, I think what's happening is that we've compartmentalized life in terms of the wave and the particle. In other words, the particle being the physical reality, the material reality, the particle being the more subtle, energetic, rarefied reality. And I would say, one of the greatest people that have impacted me has been Teilhard de Chardin, who was a French Jesuit priest. And what he said was, there's neither spirit nor matter in the world. The stuff of the universe is spirit matter. So you can't really separate out that reality from what is happening in the equation of healing. I also think that there's many variables in the equation of healing that are operative. And what I mean by that is that science is predicated and it operates based on what we can measure. Well, that which we can measure improves or increases with time. So that is always shifting. So that which I can measure today and couldn't measure 10 years ago, are we going to say that it didn't exist 10 years ago? That would be a very arrogant posture. And that which we can measure today, there's phenomena that we can't yet measure that are still operative in the equation of healing that we can have access to. So it's important to look at that piece. And then if you look at, in the equation of healing, if you look at the patient and the provider, it could be a number of individuals that relate to that: physician, healing arts practitioner, acupuncturist, nurse practitioner, whatever. You have the innate healing capacity of the patient, and you also have their own biography, their own story, their own psychodynamic reality. Then you have the provider that has their own psychodynamic reality because they're on their journey too. They don't get a free pass. So then you have the dynamic between the provider and the patient. So there is a relationship there that allows for healing possibilities to occur. Part of that comes from the skill of the provider, what they can do. But it also comes from what it is that they don't do. In other words, through their presence, their state. So I think it's interesting to look at the impact and explore this further about what about the impact of the state of consciousness and the state of the provider. The impact of the provider when they're in a state of love or a state of compassion, a state of peace. I think as we understand the more subtle dimensions of what is healing, we'll really have an appreciation for that impact in the equation of healing. Or if a provider is well-intentioned and coming from their heart, but they're frustrated because of a system that they're a part of that gives them limited time to see a patient, and their heart that they would love to be able to spend more time with. I also think there's exciting advances in research when you talk about technology. With functional MRIs, you can look at brain structure and function. And you can look at how people's thoughts can actually affect, and as well as their experience, affect the structure of their brain. And that gets into what we call neuroplasticity, how our thoughts can actually affect the structure and function of the brain. But also you can look at, as I mentioned earlier, that study of Buddhist monks that were in a state of compassion, that you can actually see changes in their brain such that their brain does not distinguish self from other in the way that we would normally would. So that gets down to a dimension of interconnectedness. And another really exciting area that is pretty much new on the horizon is the area or the field of looking at mirror neurons, like a mirror. And that came out of the University of Parma. And it's looking at the science of empathy, of compassion. In other words, how there can be a resonance between two individuals, how they convey feelings and understanding. So, for example, if a mother observed a loved one getting a shock of some sort, an electrical shock, it will actually register in her brain as it occurred in herself, in her being. Or you can look at studies looking at the somatosensory cortex of the brain. And if someone was to touch, let's say, your leg, it would register in your brain in that area of their somatosensory cortex. But there's been some studies that have shown that if you review that in a video format with an actor that's touching their leg, that can also register in your brain in the somatosensory cortex. So the key here is that it's a much more fluid matrix. In other words, there's the impact of the individual on community, local and ultimately global, and there's also the impact of the community on the individual. So I think that that's getting into the more subtle dimensions, the domain of interconnectedness, and the more subtle realm of the particle, or excuse me, of the wave itself. And I think that's exciting, and I think that research is showing some highlights on things that the mystics have known for millennia. Well, I think that a lot of that can come through the mind-body connection. I would also first say, though, that it's important to understand that healing is always possible, even when curing is not. So in other words, we can strive for greater quality of life, greater meaning in this experience. Of course, we want to transcend a physical challenge that may arise. At the same time, healing is always possible because we're multidimensional beings. We can have healing on other levels of our being that improves not only our quality of life, but sometimes even our longevity given a certain health challenge. But the area you're speaking of, I believe, are alluding to, is really the mind-body connection. And some people have actually attempted to separate the mind and body, and the body from the mind. But the reality, it's a communal reality. You can't separate the mind from the body. And there's this pervasive intelligence that pervades the body. And there's this intricate communication that happens between the fields, like, for example, of psychoneuroimmunology and psychoneuroendocrinology that looks at how our thoughts affect our experience through our immune system and our endocrine system via our nervous system. So there's a tremendous fluid communication that's taking place. Actually, there's supporting cells in the brain that can actually be a part of the immune system, and vice versa. So there's this tremendous fluid approach. We're looking at the fluidity of our thoughts on our structure and function of the brain. So this opens up a deeper window, a portal to deeper dimensions of healing. These dimensions of healing are typically below the thinking mind, below the conscious thinking mind, the subconscious mind. And in that field, there's a lot of ways to access that through meditation, through prayer. There's a variety of forms of meditation, of course. Mindfulness-based stress reduction is one particular tradition I've been trained in, but there's transcendental meditation and a variety of forms of meditation from various parts of the globe. But self-hypnosis, biofeedback, guided imagery, interactive guided imagery, there's a number of ways to access that subconscious, below the conscious domain. And at that level, we can actually plant seeds of healing that ties to our thought process. And that also ties to what I will often say is the mind is a wonderful master, but a terrible slave. And what I mean by that is the mind always wants to be the master. It always wants to drive our car of life. And what we can learn to do is to actually relegate the mind to the passenger seat of our car, or perhaps even the back seat of our car. So the mind is important. It's good for deductive functions, to ascertaining how to fit a bunch of clothes in a suitcase, for example, or how to solve a quadratic equation. But at the same time, we're more than our conscious thinking mind, and there's an immense healing capacity as we go beneath the conscious thinking mind into the subconscious realm of healing. And so I think that mind-body connection, connecting to that wisdom that's within each of us, is also a portal of entry into the more subtle dimensions that we spoke of before, as I look at it. The more of the spiritual or metaphysical dimensions. But if we're stuck in the I-ego process of I'm a doctor, I'm a husband, I'm this, you're identifying with the physical body in that sense, then you're not going to have the awareness of the deeper domain of life, the deeper dimension of who we are as people, and the fact that there's an interconnected dimension. And getting back to that original illusion of other, that you're separate from me and I'm separate from you. When we say namaste, is really a function of expression that I'm honoring the place that's within you, that when I'm in that same place, we are actually one. So it's that kind of awareness. When we can connect on those levels, we can connect to tremendous healing resources that are within us and around us through relationship and other resources. So we don't cut ourselves off through fear in that sense. Well, I would say that it's important to meet people where they are and meet them with respect. And I think that if you resist, things will persist. So in other words, it's not really a battle. It's more of a sharing process. And give people an option. Some people will be very closed-minded, getting back to the mind-body connection, that it doesn't fit for them. They're not ready in that regard. So it's exciting to meet people that are in that explorative phase, that they want to integrate more and to have a deeper experience in their healthcare process as well as in their life. So I think the key is to meet people where they are and be very respectful in the languaging. I think the type of language that we use, can actually build bridges or build walls. And I think that that's important to have a respectful communication that connects to people where they're at. I would respond by saying that, again, language is very, very important, and it can create bridges or build walls. And I think the more precise that we are in a language, the more respect we're going to be cultivating in our communication, and more inclusive in that sense. And we need to be very clear about what it is that we're speaking on. So there are broad terms. The term, again, alternative, is a relative term. Actually, C. Everett Koop, the previous Surgeon General, spoke about the word alternative in alternative medicine, and he said that's a relative term. That's relative because what is alternative to one culture may not be to another. What one person's poison may be another person's healing process. That's an extreme example, but really there's a relativity to terms. In the field of, I was very, very captivated with the word integrative, because I as an MD background practitioner and physician, I didn't want to have a purely alternative approach because there's a value to the convention as well, as we've talked about. And I really like the idea of integrative for me personally as I approached people, because it brings in of integrating the different dimensions of convention and dimensions outside convention. But at the same time, language can connote barriers, and I think that language will evolve. But I think the more precise we are in our languaging, I think that people have a better understanding of what we're speaking about. It's not, because people are absolutely wedded to certain terminology because it ties to identity, it ties to ultimately markets in that sense. But I agree, the word alternative typically and historically has had a negative connotation. Just like the word complementary, if you think about that, it implies that something that is complementary cannot stand on its own legs. You know, there's actually a National Center for Complementary and Alternative Medicine, which is a branch of the NIH. I believe it was established in 1998, and they changed the name. It used to be the Office of Alternative Medicine, OAM. So they even have changed their terminology, and they broke down there was actually 5 categories that they broke it down in categories in terms of what is complementary alternative medicine. But I think we need to be very sophisticated with our languaging to create bridges, to cultivate collaboration, so that patients can be supported maximally in terms of their healthcare process. Well, I'll give an example, and I think collaboration is going to be key. But in my training, early on in family medicine, you're trained in many different areas, obstetrics and gynecology, aspects of internal medicine, behavioral medicine, pediatrics, surgical techniques, etc., geriatrics. But the OB component, as an example, I made a conscious choice not to deliver babies beyond my training. The way I felt about that was that for me to be very skilled at doing that, I would have to do a high volume of deliveries, so that if something was beyond a normal spontaneous vaginal delivery, I'd be able to handle that situation. And I think that's an important analogy, is that it takes decades to have a firm grasp of just one healing system, be it traditional Chinese medicine or Ayurveda. Ayurveda I've actually studied and explored in India, and I'm fascinated with it because it really goes into how as is the microcosm, so is the macrocosm, and vice versa. There's a profound wisdom that ties into the field of Ayurveda as one example. But it would take decades to become a proficient Ayurvedic practitioner, as an example. So I think we have to remember this all stems from the patient. It stems from their story, their biology, their biography, their experience, their beliefs, their fears, their cultural framework, their spiritual framework, their mental framework, their relationship realities, their occupational realities. All that creates a fabric, a tapestry to connect to. So obviously, one individual couldn't provide a broad range of healing resources. They may have a specialization in a particular area. For me, my fascination is in the mind-body field and getting additional skills in that arena and applying them. But ultimately, it's first connecting to that patient's story, connecting to where their needs are. And also, it's important to have a sense of where this person is on the spectrum of need. They may actually need a high-tech approach in some respects. They may need to have a diagnostic scan, for example. You know, if they have certain symptoms that could possibly be an abdominal aortic aneurysm, they should have a scan as opposed to getting an herb, for example. So there has to be a sophistication of understanding the level of physical challenge that's present in that individual. And then having appreciation of connecting to different healing possibilities that tie and engage that patient where they're at. Partly it is also being a guide to move them more forward towards the healing process, and sometimes challenging the patient appropriately so that they can effectively take more action, take more responsibility for their healthcare process. That's an important piece. So I agree the fact that no one individual could have a full understanding of all the healing traditions. At the same time, it's important to foster collaboration, respectful collaboration between practitioners, not only within the Western framework and the allopathic framework. I can tell you that often that doesn't necessarily occur. where the wheel is being recreated and tests are rerun, and sometimes there's a redundancy in the prescription of pharmaceutical medications. They may be the right medication, but there's a redundancy in terms of what's being offered to that patient due to poor communication. And that can also lead to other problems that relate to medication interactions that are unhealthy. Another issue is that if a provider is not aware if a patient is taking an herb, there may be a side effect that relates to or interaction that relates to a current medication that they're taking. So it's important to have avenues of collaboration being established so that the needs of the patient are being maximally supported in the process. So that's how I would really respond to that. I think it's an exciting time because I think that there are less hierarchical possibilities, less hierarchy in this process, that there can be exchange, and yet there has to be also insight into what this patient needs in the more immediate sense and what they may need down the line as they shift in their healing process towards more wellness. So there's a tremendous sophistication that's required. Well, I think an analogy or a statement that Dr. Andrew Weil mentions is the importance of a sliding scale of evidence. And if we talk briefly about what evidence is, again, we've talked about the fact that science is very much tied to what we can measure, and there are things that we cannot yet measure. But there is an importance, an evidence-based movement that is growing. In other words, where's the evidence? It kind of reminds me of the 80s where that one commercial, she said, where's the beef? Now it's where's the evidence? But I think that's an important piece to understand as it relates to, for example, if something has a greater likelihood of causing harm, if it's administered therapeutically, then there should be more evidence to support its use. Okay? If something that maybe doesn't have a lot of evidence behind it, but there's no side effects and it can support health, then the requirement for evidence in that particular situation could predictably be less. The key is that also for individuals to not be denying their reality. If they need to have a more invasive intervention that may have more side effects, that's a choice that should be clearly articulated to that patient. So it shouldn't be a denial, a reality of denial. But I think there is a value to a sliding scale of evidence. Evidence is important. I feel that it's important to advance research models, for example. Research models that are more subtle, more sophisticated to the subtle dimensions of the equation of healing, that integrate the impact of thought, of intention, of observation, that integrate the domain of interconnectedness, or non-local healing variables. We certainly need to have more sophisticated research models. We also need research that is outcome-based beyond the double-blind placebo-controlled trial that looks at how effective something can occur in an individual. There's ways to explore that. But we also need to have a humility and respect for uncertainty and the things that the mysteries of life that we may never be able to measure. So evidence is definitely important. I think we need to advance it further, but also understand that healing can be stimulated by things that have modalities that have stood the test of time without being in a double-blind placebo-controlled trial. So we have to look at, what are the side effects of an approach as well? If it's a low side effect profile, and it can be even adjunctive, in other words, in addition to what's already being provided to support that patient on their healing journey, then that's something worthy of consideration. When you're talking about patient empowerment, you're talking about giving them more tools so that they can take more responsibility for their health. Thus, they become less reliant on a therapist or a healthcare provider or a modality or an herb or a manipulation or a drug. And you can argue, looking at what's happening in terms of people's approach to their spiritual process in this culture, is that there's been a backlash against institutionalized approaches to religion in some respects, where people want to be more engaged in their spiritual process. And so this is an important piece because you're creating a posture through empowerment where people are less dependent. So in many respects, it's less good for business, so to speak. And as you probably well know, in the traditional Chinese medicine culture, I believe that sometimes there's been compensation mechanisms that have been based on how well a patient is or how infrequent they need to see a provider. At least I've been told that. But it really is switching things. There is a power to and a value to an orientation where people can take more responsibility. It doesn't mean that they should never see a doctor or they should never go to a healthcare provider, but they have more tools. And they may, in fact, go to a healthcare provider less frequently. I know a very adept mind-body specialist in Tucson, who I have a tremendous amount of respect for, who is very adept in utilizing clinical hypnosis. And many of the patients he sees once. He tapes the session, does a very in-depth interview, tapes the session on a CD, and can use that. Now, of course, there's other people that he needs to see more, but he's trying to empower people so that they can do self-hypnosis. In other words, engage it in their own life in a practical way rather than seeing him on a frequent basis. In terms of the future, I also think it's important that we respect and value the world's healing traditions and decipher, extract, and apply the timeless and universal principles, healing principles that they actually contain for the healing process. And lastly, I think there's an importance about the principle of trust in the therapeutic relationship. And that is, when you look at what's happening, trust is a very important vehicle so that the individual actually initially is trusting the provider and maybe even the modality as to what they're offering. But part of the art in that process is to reflect that trust back to that patient so that they themselves learn how to trust their own healing journey. So it's a reflection back, utilizing that trust, reflecting it back so that they can trust their journey as they go forward with the additional skills and capacities that they've gained through the therapeutic relationship. Technology, again, it gets down to that reductionistic cellular approach. You know, I had a friend who actually had a friend that my best friend from medical school who went through ophthalmology training, then he did training in corneal transplant surgery, and I asked, what's your next fellowship going to be? Is it going to be on cell? I mean, the reality is we're getting further and further down to the specifics, but there is a tremendous value of what we've learned in the process. But getting back to what I said earlier about the dancing Shiva on the back of the guy with a magnifying lens, that they're so absorbed in what they're looking at in the micro world that they're losing the larger picture. So that's an important piece as it relates to the experience of medicine. Yeah, I think there's been a lot of value in terms of technology and science to look at the specifics of what's happening on the molecular level. And there's been tremendous advancements to it. I think, though, that there are very skilled healthcare providers that are also, as they look at the heart, maybe they're doing corneal angioplasty or putting a stent in, but they're also looking at the person that has that heart. And again, it harkens back to the father of modern medicine, William Osler, who again said that what's as important to understand what kind of diagnosis a person has is what kind of person has a diagnosis. So that is the historical heritage. I think due to the time constraints and a lot of the other realities of medicine that have happened in the modern era, there's been greater pressure that has impacted on meeting people holistically, although there are providers that certainly do so within the technological reality of medicine as it exists today.